So hi all, in this topic we are going to discuss about geriatric radiography. So geriatric radiography, it is a branch of medicine which deals with all aspects of elderly patients according to their age and also including their pathological and social problems. So some chronological viewpoint and medical treatment for the elderly patients starts from the age of 65 years. So the principles of geriatric is nothing but we have to give some geriatric care which is mainly important for to identify functional impairments in the elderly people, and we have to find some ways to minimize their residual function. So some kind of changes will get associated with their according to their aging. So in that thing, major things are being listed below. Integumentary system will get changed, the head and neck pattern will get changed, pulmonary system changes will occur, cardiovascular system changes will occur, gastrointestinal changes occur, hepatic system changes will occur, genitourinary system changes will occur, musculoskeletal system changes will occur, and neurological system also. In neurological system also the changes will be occur. In integumentary system, the skin become wrinkles and it becomes more lax in the elderly people above the age of 65, and the vascularity of the dermis decreases and the skin of the people begins to look paler and more opaque in above the age of 65. So the skin at the back of the hands and forearms become very thin and more fragile. Then nails will lose the luster, and some may yellow color, or the nail will get thickened, especially in the toenails, and the hair loses its pigmentation and it begins to get gray in color. The hair patterns will get changed and hair becomes more brittle, and the hair fall will also get started. The hair loss will the hair will get lost again on the scalp of their head and other body areas, and some changes will also get occur in their head and neck. So it is nothing but in head, some mild loss of visual acuity will get occur, which is also known as presbyopia. The light sensing threshold is affected, and the patient will perceived to diminish from light to dark color. Their tear protection is either reduced or increased. The skin on the eyelid gets loose, and the muscle tone also will get decreases. Some sensory neural conductive changes occur in the ear. Hearing loss is the major common. There is a loss of muscle mass in the neck, and some elderly patient will attenuated forward in the upper thoracic curve, which is also known as kyphosis. And in the pulmonary system, the pulmonary function will get changes according to the patient's age, and the lung capacity will diminishes, and the chest wall will also get stiffened. The cuff reflex becomes less effective. The normal respiratory defense mechanism also loses its effectiveness. So in cardiovascular system, some structural changes occur in the heart as of the aging process. And the coronary arteries calcification and will get calcified, and it will lose its elasticity. The aorta and its branches will get dilated and elongated. Heart valve will get thickens. The coronary artery blood flow will also be declined in the elderly patients. In gastrointestinal system, the gastric secretion, absorption and motility will get decreases. There is a predisposition to dryness of mouth, and swallowing reflex also will become more less effective. Abdominal muscles will get weakened. Absorption of iron, vitamin B12, folate also will get decreases. So esophageal motility will get declined, and also the sphincter and the internal anal sphincter will also get decreases. In hepatic system, liver size will get decreased. enzyme activity will also and the synthesis of cholesterol also will get decreased. Bile storage will production will be reduced. In genitourinary system, so it differs from male and female. For male, muscle tone and bladder capacity will get decreased. Vaginal atrophy occurs. Involuntary bladder contraction also will get increases. And in men, prostate gland will get enlarged. The capacity of urinary bladder is reduced from 500 to 900 ml. The size of the penis and testis will get decreased owing to the sclerosis of the blood vessels. In musculoskeletal system, bone mass will get reduced and bone becomes more weaker. The patient muscle also will get muscle strength also will get decreased. Intervertebral disc will get shrinks and the vertebral collapse also changes. In musculoskeletal system, automatically the articular cartilage will get eradicated. Placement of the neck and shaft of the femur will get changes. So if the patient has been undergone arthroplastic surgery, as a radiographer we have to be more conscious and we have to treat the patient who comes to the radiographic imaging department for a radiography after an arthroplastic surgery is nothing but we have to understand and adhere the limits and that have been placed on the patient's weight bearing mobility, and we have to mobility of the restricted joint. So we have to move the patient hip or knee, or we should not move the patients who had hip, knee or ankle arthroplasty. And while placing on the radiographic table also we have to be more conscious without placing any weight on the affected limb. So after arthroplastic surgery we should not we have to be more conscious that we are not allowed to abduct the patient's affected leg. And the next thing is in neurological system, the patient will get memory loss and some brain functions also will get decreased. Sensory changes will get changes. Motor and sensor motor function will also get changes. Sleep changes will also occur. Autonomic nervous system changes also will also get changes. So as a radiographer, there are some implications while doing a geriatric radiography. So we have to handle gently, we have to speak loudly, we have to take the x-rays quickly for pulmonary position and all. Next thing is we have to give some rest for the patient, for cardiology patient, and for gastrointestinal patient we have to schedule some fasting exams early in the morning for giving oral contrast slowly in the upright position, which has been used to prevent choking or for aspiration risk. And for a genitourinary patient we have to offer a bedpan or urinal readily for what purpose in a sense, so the patient will feel frequent urination for that purpose. In some musculoskeletal we should not adduct the patient hip or knee when it is undergone under a surgery. So some do's and don'ts are being described as below. We should not do any physical abuse, sexual abuse, emotional abuse or financial abuse to the patients. So these are the radiographic rules and regulations for doing a geriatric radiography. Thank you.